You're watching City Channel 4, your window to our community.
Welcome everyone to the Obermann Center for Advanced Studies, Obermann Conversations. First, I want to thank Thais Winkleblack, who's back there, for a vice president here at the bank, who very generously has been a member of one of our boards and offered this space to us in this collaboration, and we're very, very appreciative. And you have glorious digs here also. It's a lovely space. I'm Teresa Mangum, the director of the center, and I just want to say a few words and then turn things over to our panel today. First of all, we have several upcoming events that I wanted to tell everyone about. We are very excited that we are celebrating the 10th anniversary of an institute we developed in 2006 for graduate students called the Graduate Institute on Engagement and the Academy. And we are calling the celebration, since it is about engagement, Taking It to the Streets, celebrating our 10 years of the Institute. And as part of the two-day celebration, March 3rd and 4th, one of our keynote speakers that some of you might be interested in is Jennifer Scott. She is the director of the Jane Addams Hull House Museum in Chicago, and has had experience in house museums all over the country. But of course, this is a very special one devoted to social justice. And Jane Addams, the founder of social work as we know it today, and incredible community activism. And she will be talking about participatory history, museums, and their role in public engagement. And that will be at the Old Capitol Museum at 4 o'clock on March the 4th. You're all welcome to come and stay for the reception. We also have two more Obermann Conversations coming up this spring. The first will be March 9th at 4 p.m. at the Senior Center, and that will feature Dave Gould and Anita Jung, a professor in art, the Art and Art History Department, on the topic of creativity for a lifetime. The second Obermann and last Obermann Conversation will be on April 6th at 4 p.m. back at the Obermann Center at 111 Church Street. And that will be Glenn Penny from the History Department and a guest talking about doing global history locally, German Iowa, and the global Midwest. And they have discovered fascinating aspects of German history here in the state of Iowa that they'll be talking about. I just wanted to let you know a little bit about the center. We serve about 100 scholars a year, faculty members as well as graduate students, and we're especially thrilled with our working groups, which bring together faculty members, community partners, students, all sorts of people to focus on different topics and problems throughout social issues throughout the year. Our guests today are members, most I think, are all of you members or? Two of you are members of one of our working groups along with their guest, and I'll introduce them very quickly and then turn it over to them. Sally Scott is an assistant research scientist in the University of Iowa Public Policy Center, and her work focuses on, among other things, development and targeting of neighborhood revitalization strategies, the impact of foreclosure prevention counseling, and the role of faith-based organizations in stabilizing housing in neighborhoods, especially since the flood we experienced here in 2008. Barbara Baquero is an assistant professor in community and behavioral health in the University of Iowa College of Public Health, and she works on reducing and eliminating health disparities for Latino immigrants in the U.S., by helping identify, understand, implement, and evaluate different interventions that groups are using and working with Latino immigrants. And finally, Maryann Dennis has been the executive director of the Housing Fellowship since January 1993. She has extensive experience working with low-income families here in the community and with the administration of federal and private funding resources. And we are thrilled to have you all here today and so grateful for your work. And I will turn things over to you.
Great. Thank you, Teresa. And also thanks to Jennifer, standing in the back, who's very involved in organizing this. I'm going to update my resume a little bit. I did work at the Public Policy Center for a couple of years. More recently, I've been working as a consultant in community development and affordable housing, and put in a lot of time helping this Johnson County Affordable Homes Coalition get off the ground, and really benefited from the knowledge of people like Maryann and others in the community who've been doing that affordable housing work here for a long time. And I think what we've been able to do is raise the profile of it a bit in the last couple of years, and we'll talk a little bit about why we did that and also how we did that. As Teresa mentioned, we have a working group at Obermann, and we focus on what's called place-based inclusion, and we're not going to go into that into great depth today, but I think the idea is that as a community grows and changes, as this one is pretty dramatically, I mean, if you look out these windows, you'll see cranes building buildings. I think the challenge is for it to grow equitably, and we've got an issue there. And the challenge, I think, is both to increase the availability, accessibility of affordable housing in our community, and we'll talk about how we know that that's an issue, but also to pay attention to where that affordable housing is. Because if we try to locate all the affordable housing in one part of town, we know that doesn't work out well. That it's much the results for the families involved, for the community at large, is much better if we're able to integrate that housing. And in our society, racial discrimination is illegal. Overtly racial segregation is illegal, but economic segregation is not. In fact, we have a lot of structures that promote economic segregation. And so when you get involved in trying to create more economic integration, you run into a lot of difficult barriers. And some of those are attitudes, and some of them are actual structures, legal structures, physical structures, things that have already been built and are not really interested in adding an affordable component. So want to just give you today kind of an overview of the issue and some of the things we're doing about it, and then Barbara is going to talk about some of the health aspects of affordable housing, and I think Maryann's going to really talk about how you do this. I mean, and the kind of the practical aspects. So does everybody have one of these pieces of paper? If not, there may be a few more lying around. Now, I have color on my piece of paper, so you're going to be challenged because your lines are all shades of gray, but it's really pretty straightforward. I think once you get the gist of it, and that is the lines at the very top. Those are the people who earn the least, either less than $10,000 or between $10,000 and $20,000. And what it's showing is that an extremely high percentage of those folks are paying more than 30% of their income on rent. And that's really the definition of affordable housing. If you pay less than 30% of your income on housing costs, that could be rent or mortgage, utilities, insurance, you're getting into unaffordable housing. Of course, a lot of folks do that and they manage to stay in their housing, but it probably means they're going to have to cut back somewhere else. So in our community, this runs 2005 through 2014. We see that really that entire stretch of time, the folks earning less than $20,000 have struggled to afford their housing. What's very interesting, I think, is you look at the line in the middle that starts out around 60 and now is over 80%. Those are folks earning between $20,000 and $35,000. We can see that they are increasingly struggling. Higher and higher percentage of them are paying more than 30% of their income on housing. And the next line down, folks, we might think are earning a pretty decent income, $35,000 to $50,000. They've gone from 5% in 2005 to over 30%. So this is what we're up against. This is the affordability challenge, and not just us, right? This is a national issue, and it has a lot to do with income inequality, wages, household incomes staying flat, housing costs going up. So what does this translate into? As I said it's not just a financial issue, and we're going to hear more about that. If you're struggling to pay for your housing, there are lots of effects that have in mental and physical health, can both suffer and do suffer as a result. And we've got the most expensive county for housing in the state of Iowa. So we've got more folks dealing with that here, I think, than in some other parts of the state. And if you look across all these renters, all these income groups, 64% of them are paying more than 30% of their income on housing. And 35% are paying more than 50% of their income on housing. We call that being severely cost burdened. So, you know, there's a challenge in working on this. When we say, you know, the words affordable housing, for a lot of folks that kind of immediately generates an image in their mind of barracks-style public housing and people who are different from themselves, whether that be racially, economically, all of the above, living in those kind of barracks-style housing. And that's really unfortunate. You know, those kinds of buildings existed. Those public housing types of buildings have existed. They mostly don't exist anymore because they were not good public policy. They did not serve the families or the communities well. I don't think they ever existed here, and that's never been the goal for that to happen here. You know, the goal is for people to have decent and affordable housing, and that can take a lot of different shapes. But there's no requirement that, you know, affordable housing be that kind of impersonal barrack-style housing. It can really be quite attractive and really can fit into the community well. And a lot of the work that Maryann has done at the Housing Fellowship, you've probably driven by a lot of those homes, and you would never know that they're, you know, affordable. So we've got this problem. What do we do? What do we do about it? And that's what we've been trying to develop over the last couple of years through the Affordable Homes Coalition. I mean, there have been folks working on this all along. And the question is, how can we scale that up? And one of the barriers is, of course, you know, people's attitudes. So educating people about the issue, confronting some of the stereotypes, showing the good examples of what it's like when it's well done, and doing this across multiple platforms. We have hung banners downtown. We have Facebook page, website. We've printed materials, talks like this, go on the radio, go on the TV, kind of wherever we can reach people, we've been doing that. So it isn't this thing that's just discussed by a small group of people over here. It really becomes a community conversation. And to this community's credit, I think there's been real openness to that and real willingness to engage in that conversation. And you know, kind of a receptivity to it. Then there are, you know, listed down here, there are some really specific things that can be done and that have been done here and elsewhere, and we can do, or new things that we can try here in terms of working with the private sector, private developers, and with competent nonprofit developers. And it's a matter really of regulations and incentives. You can say if we as the government are going to give you any kind of financial incentive to build, we can also make some requests. We can say 10% of that or 15 or 20% of that building should be affordable. Or you can say, well, if you build affordable, you're going to get reduced parking fees or greater density. You know, there are multiple ways in which the government can structure a deal to benefit affordable housing, but it has to be a priority. And I think we're seeing that happening more in Iowa City now. There are some measures being taken, and we're working with the other jurisdictions in the area for them to prioritize it to the extent where they would be willing to put some public resources into it. And you know, another audience that's really important to this conversation is the University of Iowa. And our Obermann Working Group has organized an event. I'm going to make a little advertisement here. April 1st at 10:30 at the public library here, where we're bringing in three people who've been active in universities in different parts of the country, Philadelphia, Chicago, Minnesota, Minneapolis, to say this is how a university can engage with its community around these issues. Nobody's promising to have all the solutions, all the answers, but I think having more of that conversation with folks at the university is really important because they really haven't been as involved, I think, as they could be and should be. So I think I've gone about 10 minutes, maybe more. So I want to hand it over now to Barb to talk about these health issues.
Thank you, Sally. So thank you again for the invitation and the opportunity. I also want to thank Sally because I think she's been a leader in these issues here in the community, and to me, sort of also as a partner to think about what's the role of public health in this bigger issue of housing equity. So I am very excited that we have this event coming up and that we have our group at the Obermann Center. So been a great space to really discuss these ideas and our role as a university and the larger community too. So what I'm hoping to do in my 10 minutes, hopefully, is to sort of give you a little bit of framework and from the perspective of public health, how do we look at this problem, or how do I sort of think about the connection between housing and housing equity in public health and health outcomes, right? So maybe when you think about public health, you might think about infectious diseases or obesity prevention or chronic disease prevention or injury prevention. But we also think about these larger determinants of health, what we coin social determinants of health, right? This idea of these upstream sort of determinants and factors that are associated with the outcomes that we sometimes see at individual level. So I'll discuss a little bit of that. In other dimensions that we think about housing, it's not just your building, the physical building, but the implications in terms of their social health and your physical health. And also, at last, I will make a call for action, I guess, and an ask in terms of what could be our role in this process. I think we all can have, you're already here, so you might be interested for different reasons about the issue of housing equity in health. So think about, what could be your role on borrowing your resources, your power to sort of think about as a community how we address the issue. So in terms of public health, we've been always involved with housing in many different dimensions, but I think maybe your experience is more about sort of housing codes or environmental exposures or the physical structure of the building, right? So at the beginning was about infectious diseases or housing water quality or enough ventilation in the homes, right? That's the kind of sort of at the beginning, the 19th centuries or 20th centuries when we were talking about the role of public health in housing. But the more and more we're moving towards that more upstream look in terms of, and also the influence of housing in your social and your physical health. And so that's also part of the role of public health, I think. So when we think about housing, we also need to think about the neighborhood, right? And so it's a lot of research done around, and not only in public health, but sociologists, psychologists have done a lot of work to think about, the place that we live, the place that we shop, for example, there is a neighborhood, how that influences our health, right? So it's this physical dimension, where our house is located, which sort of talked about these ideas, like what do we think about when we think about affordable housing or low-income housing, right? Sometimes they are far away from bus stops, for example, or they are near waysites. We have a lot of cases where environmental justice and public health around environmental hazards is involved, because sometimes these low-income communities, and this is very broad in general, but in terms of low-income communities or affordable homes, they ended up in places where it's a high exposure to noise, right? So the planes or near the airport and so on. And that may be far away from work places or even schools, right? So that's the physical aspect of a home, which also has a lot of implications on health, right? But it's also the social aspect that we think about in terms of my home in the environment or the neighborhood around it. So this idea of a collective efficacy has been one sort of construct or concept that we've been studying for a long time in terms of how much we trust the people in our neighborhood, how much we feel that we can solve problems together, or even a social cohesion, right? So there's a lot of studies, mostly done in big cities, where they find that higher collective efficacy is a good thing, and therefore you find less violence in your community, more quality of life, perhaps. And when we have low efficacy in perhaps poor neighborhoods or neighborhoods that are sort of an equal distribution of resources, for example, we find that then people also suffer from that, and they're not together to solve these problems. And that could be one of the reasons why perhaps other things in the community are not being solved, because there's not such a cohesion in the community. So those are sort of important things that we think about when, and what would be important to think about when we think about affordable housing or housing equity in terms of the benefits that we can create if we have those neighborhoods where people feel comfortable and proud to be in. I think that's part of it too. So in general, this idea of both the dimension of physical and social environments and housing has the component of the neighborhood effect, right? So there is a lot of evidence around poor birth outcomes in neighborhoods that are sort of have low collective efficacy in issues of sort of environmental justice, cardiovascular disease, high rates of obesity, for example. We find them also in poor neighborhoods in general, HIV, STIs or sexual transmitted disease, mental health, a big issue. Physical inactivity is often, right? So if people doesn't feel safe in their neighborhoods or around their community, they might not be walking around, which is, we think, what we need to do to be healthy, right? And overall mortality. So we know that people perhaps die younger in neighborhoods that are less healthy and has less resources compared to other neighborhoods. So, that's sort of showing you the bigger picture in terms of some of the consequences of not addressing the issue of housing equity. And this is closer to the work that I do, and sort of my role in these conversations is the idea of how is this affect to people of color, and how or minority, racial, ethnic groups are also affected, and I would add in that case rural communities in general, right? And so how they are unfortunately disproportionately represented when it comes down to the unequal distribution of resources or the kind of housing that they lived in. And most people argue that housing is indirectly related to wealth and income. I would say more directly related to income. So if you have more money, you might then have more power. Like Sally suggested, you spend less money perhaps in housing, or you have other choices, right? You can move from the neighborhood that have less resources to a better neighborhood to be able to afford other things that are important to you. The other thing that happens when we think about the connection between your housing and the quality of your housing and income is the idea of, and especially on low-income communities and other groups, is that your house could also, you may be at risk to be energy insecure, which is another term that we use to talk about. Again, in the Midwest, it makes sense to the idea that your home may be older, or your house is not under code because you're a low resource person, so you feel that you are not empowered to talk to your landlord, telling you need to change the windows or you need better ventilation or so on. So sometimes your house will be too hot or too cold, and then it's insecure in terms of the energy, and you may have to make the choices of, do I pay the electric bill, or do I buy food, or do I pay for transportation, right? So those are sort of all those are related, and sometimes we only think about, they don't have money for food, but perhaps why do they have money for food? It's because they needed to pay the electricity bill this month, right? So those are the things, and these are the people that is most affected about these issues, right? So thinking about poverty and the consequences of that, and the connection that it has to housing. Homeownership is really important, and actually, even if you are in a low-resource neighborhood, but if you own your home, you report better quality of life and better life satisfaction, even if you are poor or live below poverty. So the idea that we can help people also to have their own home and sort of be empowered that way is also really important. So really, we are moving from, at least in public health, it's still important, and I would say, unfortunately, cases like what we're seeing in Michigan, and not necessarily directly related to the building, to the house, is related to the health of the community. So public health has a very important role still there in terms of water sanitation these days. But that's something that we know how to do. We are moving more forward to, or looking forward to these more social determinants, right? The role of housing as a social determinant of health, and it's really more about trying to understand the political climate. So we are not an experts on that. So for us is to collaborate with people like in the table and in other groups to really see how do we all contribute into trying to solve the problem. This whole idea of the market-based sort of solutions that we have in terms of not thinking about necessarily the health as the outcome and the motivation to make these sort of political changes or policy changes, but more about, who can afford the housing, or, we sell it to the best bed or something like that, right? So some of the issues that we think about too in public health. There are great examples also across the country in terms of collaborations between policymakers and local stakeholders in public health in terms of how to improve housing from their own perspective by working together. So I can go on later on more on that if you have questions. So finally, just sort of to talk a little bit about that ask that I suggested is this idea of collaborating. So for us, it's really important in public health. I think I speak for a lot of people in my college, is the knowing that what are our sort of our strength and our resources, but also collaborating with others to solve this and address these bigger issues that we have in the community. So, and for us also, is instead of moving away from we're moving away from thinking about one issue, like addressing asthma or smoking at the home environment or through healthy housing. It's more about, how do we work together to make the neighborhood healthy, right? So all these other outcomes can be decreased and to some extent. But doing this work is really hard. Again, so this idea that collaborating and bringing all these different expertise and resources, like Sally was saying, the multiple platform, I think is really helpful. So what would be our role? I think we can provide a lot of expertise in terms of doing the community assessments that need to be done to really understand this problem. I think it's important to continue examining what does it look like here, for example, in our county or in our state, the issue of housing, right? So it takes different shapes and forms depending where you are. So if we want to explore what collective efficacy really means here, we need to explore that. And I think we can, we have the expertise and we can provide that. I think another important component is bringing everybody to the table to have these conversations. So around the idea of community engagement and having an impact on the work that we do is really thinking about who is not in the table and trying to think about, okay, how do we engage those people because their voice also needs to be heard. Could be stakeholders, could be community members, but we need to have that conversation. And I think in public health, we have the expertise to help with that. Local organizing, I think, is also something that community building and community capacity is something that we can also, as a way to facilitate this process, I think public health has an important role in that. And recognizing also too, and we're really good at that, I think, at recognizing the long-term investment that we're doing in this. So this is not a 6-month project that is going to be done and we're going to find the solutions, but is it really long-term investment, and how do we look at that in a way that is possible? So again, we are, I think, again, my role is more sort of we're moving away from just codes or housing enforcement of type of codes to think about more policy and how these policies we can activate them and implement it in the community and being part of that conversation. Lastly, I just sort of, and that will be more like a question and sort of think about, I mean, you're interested in the topic, that's why you're here, or the issue that we are discussing today. But it's in this I did with Sally when I first met her, is sort of thinking about where is the low-income communities here, or the low-income neighborhoods here in Iowa City. Do you know where they are? I didn't know when I first moved to Iowa, right? And sometimes they're hidden, and that's part of the problem too. And it's not like we want to expose them and we want to make a documentary or anything like that about it, but we need to know, and I think that's it's a very discrete issue too. So it's very hard, and I have tried to do some work in terms of exploring what housing and your home means to you and the relationship with your health. With some Latinos here in the city, and it's very hard for people to actually talk about, well, my house is falling apart, or I don't have electricity, right? And I completely understand that. So how do we really think about, where they are, and what could be your role and my role in sort of being a voice and sort of help in this process. So invite you to, beyond today, sort of think about maybe coming to the other conversation that we'll have in April, but also trying to get involved from your perspective, from what the resources that you have on this larger issue that we have here in the community. So thank you.
Well, thank you. Again, I'm Maryann Dennis, and I'm with the Housing Fellowship. I'm going to start out by reading a mission statement from 1986 from the Massachusetts Episcopal City Mission that's kind of always helped me to remember why I do what I do. Shelter and decent, affordable housing is not a luxury. It is a necessity upon which access to other necessities and the development of healthy, productive families and communities most often depend. Nothing is more essential to the welfare of men, women, and children. Nothing is tied more directly to the recognition of the dignity, worth, and values of persons. Because housing is so closely related to the welfare of persons and to the recognition of their value as persons, nothing is a more basic right than the opportunity, regardless of income or class, to live in that kind of housing which supports the welfare of the family and community. Whether persons of limited income have access to adequate shelter is thus for us, at its heart, a question of justice. And I'm glad that the other panelists brought up not only individual health, but talk about healthy neighborhoods and healthy communities. And the Housing Fellowship just passed its 25th anniversary in 2015. And what we do is we try to provide quality homes to people with limited incomes. We concentrate on rental homes for low-income families. And that's because there are other community organizations in the county and in Iowa City and in the area that provide other kinds of housing and housing-related services. And so the Housing Fellowship is the only nonprofit developer in Johnson County that provides families with permanent, affordable rental homes. That means they can stay as long as they need that affordable home. We own 171 homes, and they're scattered throughout Iowa City, Coralville, and North Liberty. We're in several of the local elementary school districts. We don't own any multifamily apartment complexes. In fact, we don't own any shared areas because we really believe that the kids that live in our homes like to have their own door to go in. Their moms like it. They like to have a yard, that sort of thing. We also know that and this has been mentioned, but we also know that if people can afford their rent, their utilities, and their rental insurance, and most importantly, they like where they live, then they stay. Mm-hmm. And that creates stability stability in the kids, it creates stability in the parents, it creates stability in the neighborhoods, and eventually it creates stability in our communities. So how do we do this? Well, we access a lot of different kinds of money. We put together the financing to actually either buy land and build homes, or we buy existing homes and rehab them. And I brought these handouts. I actually also brought a picture that helps explain a little bit about how we get from a bare lot to a home. The largest source of financing in the United States for affordable rental housing is the Low-Income Housing Tax Credit Program. And what happens is it's a program, it's an IRS program. Investors receive dollar-for-dollar tax credit for 10 years on their income tax liability. So if you notice, I said that the Housing Fellowship is the only private nonprofit in Johnson County that provides permanent affordable rental housing. As a nonprofit, the Housing Fellowship does not generate income tax liability. The only for-profit entities generate income tax liability. So what we have to do to access the credit is we have to establish a for-profit subsidiary of the Housing Fellowship. Okay, we do that. We then apply to the Iowa Finance Authority, who administers the credit. It's a very expensive process to get the application in. We have to follow all of the rules that IFA sets up every year in what they call their qualified allocation plan, and we have to score that application. part of the scoring, which is interesting, some of the things that Barbara mentioned are if you're close to the bus, if you're close to a library, if it's for families, if you're close to schools, parks, grocery stores, that sort of thing. So you have to cite the project where people, again, can get the resources that they need and they like where they live and they stay. Iowa Finance Authority then says, okay, this project, we're reserving credits for you. So we've got this reservation of credits. We go out, we find what's called a tax credit syndicator, and we sell those credits to an investor. The investor then provides us money. So on the first page I showed you, there's a little chart down there, and I'm sorry, I had to kind of paste it on here. Is an actual project that the Housing Fellowship did a couple years ago. The project is 22 single-family, 3-bedroom homes with attached garages, 3 bedrooms, 2 baths, dishwashers, washer and dryers, all new appliances, geothermal heating near schools, parks. Iowa City doesn't have branch libraries, so we never get the score for that, but we're by grocery stores, that sort of thing. There were 22 homes, and the government has a lot of rules on who the incomes of the folks that live in the homes, and also, most importantly, the government then tells us what we can charge for rent. And so, of the 22 homes, a certain percentage of the families, when they move in, and if this gets too technical, you can ask me later, but have to be at or below 40% of the area median income. Area median income is a figure that's set by the federal government, by HUD. And so 40% of the area median income 60% of the area median income for a household of 3 in this area is $44,460, okay? And then 40% is lower than that. I only have 30%, sorry. Oh, no, it's on there. There you go. So basically what happens is the total project cost was about $5.4 million for the 22 homes. And what happens with the tax credit project is the investors then provide a bunch of equity so we don't have to have a lot of debt. So on this $5.4 million project, we only have fully amortized $300,000 debt, and that's the debt that we have, the $300,000 that we have from the Housing Trust Fund of Johnson County. The other debt that we carry on the project are loans that we've gotten from the state or the city of Iowa City, and those are what they call a 20-year balloon. We don't pay anything for the first 20 years, then we owe it all at the end of 20. But if we play our cards right and really are really nice to the governments, they're going to say after 20 years, you know what, you guys do such a good job, you don't have to pay us back. So that's what we're hoping.
That's the plan.
That's a good plan, isn't it? And then we tossed a little... Right. We did our part. We put in $17,500. I mean, come on. So anyway, the cash that the investors provided was $4.1 million. So what that means is we can meet the covenants and restrictions of the subdivisions. Okay? Subdivisions say how big the house has to be. It has to have a garage. It has to have this size. If it's 2 stories, it has to be 1,800 square feet, that kind of thing. By lowering the debt, we can build what's ever required. We can do things like geothermal and full appliances. You can drive by these homes. You can't tell that these are low income, which is a term we don't use. And we can lower the rents. So the rents for a 40% household for these houses is $704 a month. And for a 60% household, they're $906. In this market, those houses would easily rent for $1,500 a month or higher, okay? So On the back of this sheet, it then explains the tax credit program a little bit more. It's kind of boring, I think. But anyway, what happens then, because we're a nonprofit, we've got this nonprofit out there, they really own the project, okay? And they get the credit. They get a credit every year for 10 years. They're in the deal for 15 years. But the houses have to remain affordable for 30. Well, these guys that invest in these, you know, it's big banks, it's big utility companies, big insurance companies. They're not in the affordable housing business. They want out of the deal as soon as they can. After 15 years, they want out. Well, the IRS has this great rule that says after 15 years, there's the right of first refusal. If a qualified nonprofit can come in, they can buy all those houses for $1 and any debt. So that's our plan. Because they have to remain affordable for another 15 anyway. That's why I'm saying that we have to be really nice to the government so they forgive all this other $1 million at the end of that time. The families that live in our homes, it's interesting. I just did the statistics for 2015, which might kind of surprise you. 83% of the heads of our households work full-time. Mm-hmm. The average income is less than $22,000 a year. So these folks are working in jobs that you and I take advantage of their service every day. They fix our cars, they cut our hair, they check our groceries, they take care of our elderly, they take care of people with disabilities. They also stay a long time. The average length of stay of the folks who live in our homes is 53 months, which I can't really find the statistic, but from what I can tell, that's longer than the first-time home buyer in Johnson County stays in their home. So, you know, again, that contributes to stability across families, neighborhoods, and communities. And that's about all I have.
Great. Wow. I think we'd like to open it up for questions, comments. I know we have some people here with lots of interest. Yes, in the back.
What are your future plans? Any projects on the burner?
Maybe identify yourself and say.
Howard Maryann.
Uh-huh. Mm-hmm. And who are you asking for? Maryann or?
Might as well be a Maryann.
All right.
Anything else, jump in?
Yeah, we can.
I'm always looking for land. Always looking for land. Land is very expensive in Iowa, in Johnson County. In fact, it's interesting. The Iowa Finance Authority, from 2009 until 2015, had in their qualified allocation plan for the credits a per unit cost cap. From 2009 to 2015, that per unit cost cap included the land. Before 2009, you could take the land out. And there was a group of us in Johnson County that lobbied the Iowa Finance Authority relentlessly. And in 2015, they took the cost of the land out of the per unit cost cap. So we feel like we're back in the game.
So if I inherited some land, you would be ready to step up and buy it, and we'd close in 60 days. I mean, do you have that much cash? Is kind of what I'm asking.
When you're dealing with public financing, nothing happens in 60 days, and I'm sorry to say that.
What's the time frame? What time frame should a fella plan on?
The applications are due in December. IFA awards the credits in March. There's no money available until July.
Okay.
And what invariably happens is you don't get started construction until the middle of winter,
Sure.
which is also expensive.
Thank you.
Hi, my name's Amanda Van Horn. I first got interested in questions about affordable housing when I was serving on the vestry at Trinity Episcopal Church and was the point person for some of their efforts. I'm no longer in an official role with them, but that's sort of the background that I'm bringing to some of my questions, and I think that's relevant. I'm really curious what happened in 2010 and 2011, either in Johnson County or nationwide, that turned that one line pointing, that middle line pointing up. And if there's anything we can put our finger on. I was surprised that it wasn't the floods and that line didn't turn up 3 or
Right.
4 years earlier.
That is a good question, and I'm just going to have to speculate because we haven't looked at the numbers under the numbers, but there was a stimulus package, and I think the recovery was kind of starting to happen at that point. So that would be my best guess, that there was some, because this is all about income as well as housing costs. So if there's anything that stimulates income, that's very helpful. And I didn't mention this during my remarks, but while we focus our efforts very much on housing, we're very aware of other efforts, grassroots and other advocacy efforts to increase the minimum wage, in some cases to unionize. I think that's really a critical piece of the problem here. And I think increasing, as Johnson County has done, increasing the minimum wage is going to make a difference. I think if nationally, we can begin to get either a higher national minimum wage or just more places around the country raising their minimum wage, that's going to begin to help some folks afford their housing.
You addressed one of my other questions, which was about the change in minimum wage in Johnson County. But then my last question, at least for now, has to do with affordable housing versus workforce housing. And one of the things we tracked pretty closely had to do with the definition of workforce housing, and the city did redefine that. But what's the stock? You've talked about the stock of affordable housing. What's the stock of this workforce housing, such as it is in Johnson County, and is that also an equally concerning issue or not?
It may depend where you sit, if it's equally concerning or not. Our coalition, when we look at numbers like this, it's pretty clear that it's people under 35,000 who are facing the toughest time finding affordable housing. And those tend to be people under 80% of area median income. Maryann introduced that concept. And particularly people under 60%. Okay, so that's really the top three lines are really people under 60% and even under 30% of area median income. When you start to look at 80% and above, maybe up to 120% of area median income, so that would be, these lines, probably not the very bottom line, but the two other than at the bottom that are not the very bottom. So you can see, that's starting to go up. I don't think the need is as intense for workforce as it is for affordable. I do know the local business community is very concerned about that, and I would love for them to be equally concerned about affordable, but I understand that, they're hiring people in that wage range often, and those people come in thinking, hey, it's Iowa, I'm moving here from, Chicago, San Diego, right. It's going to be, and then they're surprised. I talked to somebody who hired a woman who earns over $100,000. She thought, I can buy a brand new condo and won't need a car, and I can walk around downtown. And she was shocked. That was not going to happen. So she ended up living somewhere where she does need to have a car and having to commute. Now, it's no huge hardship, right? She's earning over $100,000, but it is an issue for, and this was a university person, the issue for those businesses and university departments that are trying to bring those folks in. And so I think, as often happens, when a social issue starts to affect people at slightly higher incomes, more attention is paid, and I think that's fine as long as we direct that attention to the folks who are at greatest risk and greatest need as well.
It's related, but not. But one point that in a conversation that we have, and I think is an opportunity that we have here in Johnson County, is at the same time this whole the all these contractions that is happening, right? So, and I think the coalition is doing an incredible work around lobbying and sort of creating awareness about this is the opportunity to do something before it gets even worse, or what can we do, right? So I think that's also important in terms of thinking about all these issues are important, but I think that the unique opportunity that we have is that there's people that are thinking about this, and then as these plans are being developed and sort of planning for the city, that these policies can be implemented and changed, so we can plan smart about the future of the whole community in general, right? So that, and also the other thing that we do in our place-based inclusion group is start thinking about students, and sort of that's sort of a different sort of group of people that here in the city that we need to think about in terms of affordability for housing and the quality of their housing as well, right? So that's sort of part of that conversation.
Yeah. And if you're looking at how do you judge kind of success when you're doing policy work? It's challenging, but it really a lot has to do with allocation of resources. So whether you're looking at your household budget, a nonprofit budget, or a government budget, a budget says a lot about your priorities and your values. There's within a lot of constraints for sure, but where are you prioritizing where your money goes? And what I think we're beginning to see. And this would have to continue for many years, I think, to be able to start to address this need, is greater allocation of resources toward affordable housing. So Johnson County Board of Supervisors in this year's budget has $600,000 allocated toward affordable housing. They're going to issue a bond, a general obligation bond. If all goes well, deposit that money in the Housing Trust Fund, which is a nonprofit intermediary that gets money from both public and private sources, mostly public, and then takes applications from nonprofits to where it should go. And that money,
They give me the money.
They give Maryann most of their money, but that money would not have to be paid back to the supervisors. Would pay it off from their general tax revenues. The Housing Trust Fund could then loan some of that money, and then when it comes back in, they can loan it out again, so it starts to revolve. And if that happens, and they'll make their final decisions in March, but things are looking very good because the current set of supervisors believes in this, we start to see greater potential, not just in Iowa City, but in other parts of Johnson County to do good projects. And to create maybe incentives for some of the for-profit folks to do more than they're doing. Another potential pool of money is as this whole riverfront crossings area to the south of us gets developed. We hope to see inclusionary housing where developers are required to put a certain amount of affordability in. That legislation is still in the works, but in some cases, for whatever reason, they won't be able to include the number of affordable units, but in those cases, they'll have to put money into a pot that the city will control, and they can use that to support affordable housing elsewhere in riverfront crossings. So I'd say if we're looking down the road 2, 3, 5 years, if we don't see a significantly greater allocation of resources for affordable housing, we can't expect much to happen. It just takes a lot of money. I mean, this one deal for 22 homes was over $5 million. So that's what's hard about this work, right? It's not like you can say, okay, suddenly discrimination is no longer legal. We've kind of addressed it. Those are critically important laws, any anti-discrimination. But those things don't require capital. This work does. So I think that's what we're really shooting for in the long term. And, the hope is that there will be, additional resources from state and national sources as well. But right now, those aren't happening. Nationally, we've seen the amount of money for housing, except for the housing tax credit, which has stayed pretty strong, but other sources have shrunk. So I think the more we can do to strengthen sources of funding available locally, the better. And then we're starting to talk to people in other parts of the state as well who are dealing with these issues.
I wonder, and this might be asking you for a preview of your April event, but have you all seen other programs around the country or to do with health in communities as well as actual housing that you think would have real potential here that your guests, for example, might be talking about when they come in April?
Do you want to talk about that from the health perspective? If you
Sure.
any examples?
So from the health perspective, it's very tied to policy and sort of working with local policymakers on sort of the ordinances and so on. But one thing, for example, and it has been around particular health topic like asthma or smoking. So I think smoking is really good in terms of sort of moving to sort of free smoking housing and so on. So how do you work with the city? And I don't know necessarily a context like Iowa City, but in terms of then creating and sort of building capacity within a housing complex or a neighborhood where people are usually renters. Sort of more affordable housing, and then they provide services and resources for families to quit smoking if there's a smoker in the house, but also to provide the resources to support sort of free smoking neighborhoods or apartment buildings and so on. So that's been very particular. But it's other efforts more around education, providing a daycare, for example, if your parents have to work, so they stay home or things like that. I think one thing that are very interesting, and that's also part of our conversations to it, a concurrent issue, not just only the stock and the new buildings and new housing, is the reinforcements of the policies here in terms of some of our trailer parks and the conditions that they have, right? Sort of thinking about, so changing some of the policies so the owners of these buildings, for lack of better explanation, have the legal venues or the resources to do something about in terms of moving or, what are the conditions that they live in. And this is happening here in Iowa City. So that's something that we also can work towards in terms of creating more awareness and also changing policy, basically. So these individuals and these families have more leverage to advocate for themselves. I would think that.
Yeah, a little bit of a preview. So in April 1st, that event I mentioned, we have people coming from Drexel University in Philadelphia, from University of Illinois in Chicago, and then somebody who used to be at the University of Minnesota. Now he's with the city of Minneapolis. And just a couple of examples of things they've mentioned to us that they'll be talking about. The woman at Drexel, who's, I think, similar position to yours, Linda, Vice President of Community Engagement and Outreach, but in a much more dense urban community. So she said, well, we've struggled with this. I said, I know, we're all struggling with it. We're not expecting people to come with all the answers. But she said she has regular meetings with community development corporations. Now, we don't have those here, but there are groups that kind of look at are based in a particular neighborhood or geography of a city and work on a number of fronts, could be housing, economic development, education, depending what that community needs to improve that area. A lot of big cities have them. So we don't have them, but we have housing experts. We have groups like Habitat for Humanity that are interested in going beyond, just house by house and looking at some of the neighborhood issues that Barbara mentioned. So could there be a way to have more kind of university support connection to some of those nonprofits in town? Maybe participation in our coalition on a regular basis. I don't think we're looking for, we'd love it if, there were tens of millions of dollars to bring, but we know that's not realistic, a public university that's got lots of budget issues. But bringing more, there's a lot of expertise. There's a lot of people here who are very talented in organizational issues, or maybe, have, kind of financially, there's a lot of creative financing involved in affordable housing. And so if there are people with that kind of expertise, I think it would be really fun to get them more involved. So I think we're looking for those kinds of sparks, when those folks are here, just to see, and also for some kind of mechanism so that if as the sparks develop, there's a way to carry them forward, so that the potentially productive collaborations can ensue from that. And I was going to say the guy from Minnesota now works for he heads this big department at the city that's in charge of economic planning, affordable housing, economic development. But when he was at the university, he worked with a lower-income neighborhood that was not adjacent to the university. A lot of times universities get involved because the problem is right on their doorstep. Right? University of Pennsylvania is a very good example of that. I mean, people were getting robbed and shot right next to the university. And so they felt, God, we have to help. We have to, we have to address some of these issues. Here, that's not, thank God, right? That's not the issue. There's a lot of crazy students downtown late at night, but you're not having the kind of severe issues that some other universities have dealt with. But University of Minnesota was working with an area that was really not adjacent, was further, a couple miles away from the university, but which, was struggling. And for reasons I hope our speaker explains, was a promising area for them to get involved with. And so they went and they kind of looked at some of the economic potential of that area, but also I think the potential for the university to provide some kind of economic stimulus to it. And we don't have, coming here from Baltimore, we don't have the hardcore depressed neighborhoods that a lot of these bigger cities have. But, we got areas that could use some help and maybe some university presence and stimulus. So it's pretty amorphous at this point, but I think there are ways in which the university could, in ways that would benefit students and professors as well, get more engaged with some of the neighborhoods that are, that do have struggles and do have folks who need better jobs, need more opportunities.
I think we're at the end of our time, although we've got refreshments and people can certainly stick around for a little while and chat. I want to thank Thais Winkle-Black and the bank once again for hosting us, and let's thank our panel for a fascinating discussion.
You're watching City Channel 4. On TV, online, on demand, on Facebook, and now on the go on your mobile device.